You're watching KPIX 5 News at 5:30.
The CDC weighs in on upgrading face masks. We talk live with the Chief Medical Officer at MarinHealth about how to properly wear yours. And we're joined now by Dr. Karin Shavelson, the Chief Medical Officer at MarinHealth. And Doctor, thank you for joining us. We wanted to first get your take on the new rules from CalOSHA taking effect on Friday. The biggest change requires employees who have been exposed to take a test at a lab or in front of a supervisor instead of at home. So, first of all, do you think this is practical given the strain that we're seeing at testing sites?
Hi, thank you for having me. I think that's going to pose a real challenge, unfortunately. Testing sites are heavily impacted. While we're benefiting from some beautiful weather here in California right now, I can imagine long lines and pouring rain would not be well received by people who already may not be feeling great. Definitely testing centers are impacted, and I have to give a little plug here right now. So our emergency departments, we're seeing patients arriving expecting routine COVID testing. They don't have emergencies, they don't have an urgency, they just want COVID testing. So I also worry very much that it could impact the operations of our emergency departments, which absolutely need to focus on emergency care.
And the CDC said today it will not change its recommendation on masking, sticking with the idea that any mask is better than no mask. But some people are feeling a little bit confused about some mixed messaging. Is a cloth mask okay? And what's your take on surgical masks versus N95 and KN95 masks?
Well, the theme of the news about masking and testing and COVID seems to change often, continues, right? So masking, I highly recommend, if you're able, if it's within your financial abilities, if you're able to find the masks, which can also be a challenge right now, I would highly recommend at a minimum a surgical mask. Even better would be to double those masks. You need to get a really good seal on a surgical mask for it to be effective. The CDC released a video that I think does a really good job of showing you how to get a better seal by twisting the mask at the ear loops and applying it to your face in a way that gives you a much better seal around your face. One way to know if you don't have a good seal, if you wear glasses and your glasses are fogging up, you don't have a good seal. So try it with sunglasses if you're not a prescription glass wearer. I think if you're able to find and afford a KN95 mask, or if you know what size N95 mask you wear, that is absolutely an option as well. But I know for some people, either because of their comfort level or their financial circumstances, a cloth mask is the best they can do. And I agree, that's better than no mask at all.
Can you reuse those KN95 or N95 masks?
You absolutely can. There's no set duration because it depends on how long you're wearing it for and under what circumstances. In the hospital setting, we usually say 48 to 72 hours, but realize that may be somebody wearing that mask and potentially caring for COVID patients for much longer than the general public might go into the market, for example. And I think the only other thing to consider is if we start seeing a shortage of the KN95s or the N95s, we'll need to be mindful about preserving the supply for our first responders and our healthcare workers.
Definitely there. Well, there are signs the Bay Area may soon see the peak of COVID cases in this latest surge. Sonoma County now asking people to stay home for the next 30 days. Other counties are not implementing new restrictions yet. So what do you think is the best strategy for getting through the next couple of weeks?
Well, I know it's rough with this beautiful weather that I mentioned, and most of us have a 3-day weekend coming up this weekend. So my recommendation would be to try to avoid large gatherings. I know it's really tempting to hang out with your family and friends in a big group and to barbecue this weekend. It's lovely weather, but I'd highly recommend against it and try to stay within your household if you're able to. I think that as much as you can do things out of doors, although remember, Omicron is as contagious, if not more so, than measles, which is one of the most contagious viruses that we know about. So even outdoors right now is not necessarily 100% safe. If you're unvaccinated or unboosted, now is a perfect time to get vaccinated or to get your booster, and that will add to some sense of security and certainly help to reduce your risk of serious illness or death.
All right, thank you very much, Dr. Shavelson. Some good information, also some good advice.